Alrighty, and we're live. Good morning, everybody.
Good
It is a
morning.
bit earlier for some of us than others. So first and foremost, we're gonna do our little disclaimer that we are not here to treat anyone. Always consult with your doctor. We are here to educate and inform, and so here we are. All right, so this morning we have Robyn TOWT, and Robyn is a dear friend to both Danielle and I, and we are so excited to have her here with us. We both met Robyn back in last March at the FDA testimonies, the FDA hearings, and she just
blew me away.
fresh air, right? She's just a shining star in our community. So Robyn is a cancer survivor. She has had cancer 3 times. I'll let her tell you more about that. She's a wife and a mom to 2 really tall, amazing young men. And she has testified before the FDA twice, not once, but twice. She is working with the Arizona state legislators to make more informed consent for women with implants, and also now working to promote change in California and I hear Pennsylvania.
We're getting stuff started out. Yep. Exciting stuff.
Robyn, welcome. Thank you so much for being here.
Thank you. Thanks for having me, you guys.
Absolutely. So I just want to start by saying, our community is a tight one. And if you're in it, you know what I'm talking about. And we know each other so well, and yet it seems as though I don't know everybody's story. So I'm like extra excited because I don't know some of the details about you, Robyn, and I'm really excited to learn them. So let's start with, you've had cancer. I know during your FDA testimony, you had said that you had cancer 3 times, and it was like nothing compared to suffering from breast implant illness. So can you start by telling us about your history with cancer?
Yeah. I actually was diagnosed with my first cancer when I was 23, and I had just gotten out of college, and I was diagnosed with Hodgkin's lymphoma. So I had really expensive radiation treatment, and my oncologist was super, he was great. I was young, I didn't know a whole lot, I didn't know what questions to ask, but he was really honest with me, and he was upfront and told me that my radiation exposure could cause secondary cancers later in life. So I was always really diligent about my health and my checkups to stay on top of things. I had a pretty good run for about 10 years. And then I started growing some benign tumors. I had part of my lung removed. I had my thyroid removed. All the tumors were benign, but just kind of causing some health issues there. I had basal cell carcinoma where I had really bad radiation burns during treatment. So I just kind of stayed on top of things. And then about 2015, I had a biopsy on my right breast, and it came back benign. So I just, made sure to go for my mammogram every year. And I also, because I was high risk, got a ultrasound with my mammogram every year. And then in 2017, I had a biopsy on the left side, and it was breast cancer. So it was a no-brainer for me to remove both breasts and have a double mastectomy, because I had already had a biopsy on the right side, and it was kind of like, I just wanted to be done. And it was interesting because I actually didn't want to do reconstruction. It was one of the last summers I had with my kids before they went off to college. So I really just wanted it to be very easy, and I wanted to be done quickly and just kind of go on with my life. But my surgeons and my team of doctors kind of pushed the reconstruction on me. They make you feel, as a breast cancer patient, they make you feel that if you don't do the reconstruction, you won't feel like a woman. You won't feel whole. You won't feel normal. So it was a very taboo. Nobody was really talking about not doing reconstruction. So reluctantly, I did it, which I believe happened for a reason, because I got super sick right away within 24 hours of getting my expanders, my implants. I felt great when I had breast cancer. And I know I say that in my FDA speech, And it's true. I felt great when I had breast cancer until I got the implants. Um, and the interesting thing is, I didn't do chemo or radiation. I'm not allowed to have any more radiation because I've already had too much. And I chose to opt out of chemo, even though my doctors wanted me to do chemo and tamoxifen. So I literally had no treatment whatsoever besides surgery. And what I started noticing in some breast cancer support groups is these ladies were complaining about all the same things I was complaining about, and they were blaming it on chemo. And I was really confused because I didn't have any chemo and I didn't have radiation, so I could not figure out why I felt so crappy. I had gone back to my doctor several times. She told me it wasn't my implants. I was telling her that I had severe pain, severe fatigue, insomnia. I couldn't sleep. And she just threw pills at me. She gave me sleeping pills. She gave me pain pills, muscle relaxers. And I don't really like to take medications. So it all just sat on my bathroom counter and I was miserable. And another breast cancer lady was actually sick with the II before she found out she had breast cancer. And she was the one who reached out to me online and said, look into your breast implants. Mine made me sick for 12 years. So I asked her, sick, what do you mean sick? And she started naming the symptoms: neck and shoulder pain, hair loss. And as she named her symptoms, I was just like, check, check, check. Yeah. And it was a no-brainer. I only had my implants in for 4 months. And I had them removed and I felt better literally when I woke up from surgery. It was amazing. The transformation for me, I knew I was sick and I knew I felt really crappy, but until I got them out and felt better and felt normal like I did before any of this started, it was shocking to me.
That delta's amazing.
What's that?
The delta, right?
Yeah.
And you don't even know how much you've carried or the weight of which, and then, the context of maybe this is the cancer, maybe this is getting older, maybe this is how life is supposed to be, and then boom, it's not that way.
Yeah. And you're right, Danielle, because at one point I had been back to my plastic surgeon about 4 times with complaints. And when she kept telling me there's nothing wrong, for a split second, I thought, oh gosh, it's my cancer, because I didn't do chemo. My team of doctors wanted me to do chemo and I didn't. And this is my punishment. My cancer is back. It's stage 4. It's head to toe. Because I was having migraines, headaches. My vision was getting more blurry. I wear glasses, but my vision was getting blurry. My hair was falling out. My eyelashes were falling out. Heart palpitation. It was head to toe.
Yeah.
And I thought, oh, that's it, man. This cancer's taking me over. I'm gone. I'm a goner. I thought, if it's not the implants and we can't figure out what else it is, it's got to be cancer.
Right. I wonder how many women who are sick with breast implant illness actually think that it is cancer. Because I know that was what I was thinking. Like, this must be some kind of cancer that I've got, because like you said, head to toe, nothing else makes sense.
Yeah.
And they can't find it, and the lab tests are otherwise normal, and yeah, for me, it was like, oh, you're 48, 50, you're in menopause, this is how it's supposed to be. And I was like, well, then just shoot me, because this sucks.
Yeah, I don't want to live like this. Yeah.
No.
I think that's frustrating for a lot of women, because they do just think it's age or their stressful job or busy family life. And what really hit me hard after I took them out and felt so good is, oh my gosh, how many other breast cancer women is this happening to? And they just think it's from their chemo, because the majority of breast cancer patients do go through some kind of other therapy besides just surgery, whether it's radiation, chemo, or both, or the hormone blockers. And that really hurt my heart. It really did. And that's why I do what I do. Because I know it's not just me. So
how did you start then with your advocacy? How did you get involved with the groups and being admin on groups and all that stuff? How did that transpire for you?
That was interesting because when this happened to me, my friend, who is now one of my best friends, the girl that saved my life, she actually lives about 15 minutes away from me here in Arizona. So, we would get together for lunch or talk on the phone or text, and I knew about the Facebook groups, but I wasn't on Facebook at the time. So I was kind of like just learning things through her. And then I would do, research on different articles, but I was more the first year in the breast cancer communities. Um, and then just trying to tell my story there, like, hey, you guys, this happened to me, and it could be happening to you too. I will say I was not well received in the breast cancer community, because back in 2017, the FDA had not even acknowledged breast implant illness. The big blow up with ALCL wasn't even a thing yet. So I think the breast cancer ladies kind of thought I was crazy. And then my friend Michelle, who saved my life, she saw a post somewhere that they needed one more person to go to Washington, D.C. to testify at the FDA. And I wasn't on Facebook, so I actually reached out to Jamie Cook on Twitter, and I was like, "Hi!" And I had actually had a conversation with Jamie several months before, just kind of asking her advice on how to get into advocacy because I'm not on Facebook. And so at least I had had that prior conversation with her, and she was very honest with me. And she's like, "I just want you to know, like, it's expensive. It's a last minute trip to DC. We're going next week." And I was like, "I don't care. I'm there." So I flew myself out to DC, and Terry Diaz was my roommate, and we clicked, like, we hit it off instantaneously. And so that was the start of it. And Terry actually, while we were in DC, set me up on Facebook. And because I'm technologically challenged. So Terry did it for me. Thank you, Terry.
Oh, I love her.
And it just kind of started from there. And I found all the groups and started posting a lot and answering questions. And I liked that part of it because there weren't a lot of breast cancer ladies at the time. So I felt like there was definitely a need for support for the breast cancer ladies. And then that just really turned into BISA was born like after we went to the FDA last year, the 2-day hearing. I love our community because it's so beautiful to see everyone's passion and everyone's different angle on what they're passionate about. Like Tara wrote her book, and Danielle, you're doing the Health Summit. And it is such a beautiful thing to see a group of women and foster their strengths and work together collaboratively to spread awareness, help each other out, post each other's stuff, just to get the word out there and support each other.
Yeah, and
So
for those
looking back from
for those who are listening too, it's not, and I don't want to speak for both of you because it may actually be different. But for me, it's not about hating breast implants or innovation or things that we can do to feel more, better, different, however we want to be. I mean, like a tattoo or whatever, but it is knowing what's in the ink. Our heavy metals in the ink are deregulating immune system contents in a breast implant for some. Like, it is about the safety and what do we know behind it. And, there's an underlying conversation, Robyn, that you just like popped in my head. And I don't know that I have a question, but I'd love for you to run with it if you feel comfortable, is that, the doctors, yeah. I'd like to think that they mean well, but by God, you have to get an expander because I want you to feel whole and complete and feel like a woman, and like all these undercurrents of what defines us, right? Like, I mean, it's a little bit of a heavy right. thought, but like how did you, like, I don't even know that I've gone through the thought process of what defines you to, stand up and make the difference, and then be able to go to that breast cancer group that everybody's struggling with the same context, that their doctor has funneled them into this way because this is what you need to do, because, like, how do you get your backbone and all that? Because that's pretty damn awesome. Sorry,
It is a frustrating part of the breast cancer experience, because it is pretty much. Can you guys hear me okay? Because it seems a little choppy.
You're freezing up a little bit.
You guys are okay, but it's expected. Okay.
Yeah.
It is expected to do reconstruction, and you know, I'll be honest with you, a lot of women can't even fathom the thought of living without breasts.
Yeah.
For me, I'm pretty feisty, and when I realized what they were doing to me, I didn't care, because people are like, well, did you do fat transfer? Are you doing some other kind of reconstruction? I have no interest in breasts whatsoever. I am so jaded about breasts, and I want people to know, like, I feel empowered now that I have not changed one bit. I'm still the same wife. I'm still the same mother. I'm still the same friend, sister, daughter that I always was. It had nothing to do
Maybe
with
a little more
my breasts.
feisty.
So,
Maybe a little more feisty.
I agree. Maybe even that much better if it's possible. I think it's made you stronger, better, more amazing, you know, all of those. And you guys actually touched on a question already. We had a question about how did you decide? We have a woman, Gina, who she's really at that crossroads there where she knows implants are not for her now, but to do the DIEP reconstruction or go
deep
flat.
flap.
Yeah, she's really, I think, trying to make that decision, and she wants to know, like, how did you, and I think you already touched upon that, how did you get to that point in deciding that going flat was for you?
It's a very personal decision. For me, the timing in my life drove my decision 100%. Obviously, the flap surgeries, they are very long. They're very complicated surgeries. So then you end up with multiple surgical sites. So not only on your breasts, but you have a surgical incision, maybe in your tummy or your back or your legs. I wasn't up for that. It just, it's all what you're willing to go through. And it wasn't that important to me.
And to digress for this woman, if she can listen to last week's presentation and maybe reach out to Susanna to know what the options or sequelae for each incision may or may not be. Like, it may or may not happen to you, but if you can be with the potential risk, even though X might be rare, it's an informed choice, and make it a choice and make it a powerful one. If you want breast implants, make it a powerful one, but be informed. Go to the X and the Z of it, because what one doctor tells us is not, it might be his full disclosure, but it is not the full disclosure. And so, how can we empower you to know the left and the right so you can make your own choice? Like, for me, that's a big deal.
Yeah, absolutely.
Yeah, and that's my driving force for sure. Informed consent, because there are reconstruction procedure that's easy. It's a long, difficult journey. And one of the most surprising things, I think, for people is it does not look anything like real breasts. In clothes or swimsuit, you could pull it off, but I mean, I've seen some, but they don't feel the same. They don't look the same. And it just wasn't, I think anger was probably part of my decision too, is I just was done. No more. Don't touch me. I don't want anything, because I really ended up with a lack of trust for my doctors community, because they've failed us greatly in that department.
Yeah.
So
what did you do with the anger today? Like, is it still there? Is that what wakes you up at 5 a.m.?
I'm sorry.
What did you do with your anger today? Like, where is it today? Like, how did you release this?
It's a little early for my anger today. I usually wake up and look at cute animal videos. Today it was a a beaver who had a rescue home, and they built a pond for him, and baby otters. So got to start your day off right with coffee. Gotta have coffee.
I love you, Robyn.
Oh, oh God, that's hilarious. Mine's
So,
for hummingbirds, but I get it. Wherever you can fill that tank, right?
yes, absolutely. And it looks different for everybody, but we all got to fill it our own way. So, okay. So you went flat and you said, I don't want this to happen to anybody else, anybody's daughters, anybody. And you ended up at the FDA once. And how did that go? What was that like? And you obviously met some of the people that we're friends with now and all of that. How did it look from a
Yeah,
advocacy standpoint?
that was an amazing experience. You remember, Danielle. Um, it was a very powerful day when we had that meeting. Um, I felt like I was in the right place and I found my tribe. And, it was almost like a day of redemption that someone was finally listening to these women who came along before me. And they just wanted to be heard.
Mm.
So it was very powerful to be able to sit in that room and tell our stories and, demand action and ask for help. This has gone on much too long, and the lack of accountability, quite frankly, is very disturbing to me. So we have to fix that.
And how did you understand? I mean, and I don't want to jump ahead, but I am so curious. Like, when I think legislature and all of that, I just kind of want to take a nap. But you've made like legit change, like legit as in legislative change.
Yeah.
And I don't want to jump the gun, but like, how the hell?
I'm glad that you're jumping ahead because I do want to get into that because I want other women to feel empowered to do this too.
Because I wouldn't even know where to begin, and
Yeah.
then I
know
get
we were
stopped,
working on
honestly.
There's a delay on her phone.
Oh, I missed that. Sorry, it froze. Yeah,
That's
sorry.
okay.
I missed that, Danielle. Sorry.
No, I was just saying, like, I'd love to hear more about the legislation. How do you make it seem so easy? And when I think about it, I get stopped, right? Like, I just like write another email, like, And maybe it's because I don't feel like I'll be heard. But you were heard loud and clear. And
it's hard. Yeah. I think the biggest thing was I thought, how can I prevent what happened to me from happening to other women? I know we're working on the Medical Safety Device Act in DC. Federal legislation is a very slow process. And I've never in my life been interested in legislation or anything remotely similar to that. But I thought in my head, why did my surgeon not tell me this? Why did my surgeon not have this conversation with me? I did sign some informed consent documents, but she never really thoroughly had the conversation with me on that this could happen. And I don't want that to happen to anybody who's getting breast implants. As breast cancer patients are overwhelmed as it is. When you are first diagnosed with any kind of cancer, the whole process is grueling. You have appointments, tests, labs, scans, an appointment with your oncologist, an appointment with nutritionist, an appointment with your, radiology team, your chemo team. It's so overwhelming. And then surgery, plastic surgeons. So your head is spinning and you trust your doctors and you expect them to be honest with you. So I thought, they weren't honest with me at all. My breast surgeon and my plastic surgeon were completely dishonest with me. Even when I went back with problems, they were dishonest with me. When I went back with problems to say, some women get sick from breast implants. And she didn't.
What?
And I could have suffered for years.
Yeah.
Yeah. So I thought, no, this is not okay. They need to know upfront that this is a possibility, and then they can make an educated choice to take that risk if they so choose. But then at least if they have this device in their body and they do start getting sick, they know what to look for. They know the symptoms to look out for. And I read some of the very minimal risks that were on the informed consent, but I'll be honest with you guys, I didn't even know what lupus and connective tissue disease was.
You have that on your informed consent,
okay, I understand
though?
this can happen to me.
Like they actually had that on your informed consent?
It just had a little, it had a little spot to initial, but we didn't have a discussion about it. And then when I started having problems, my doctor didn't even bring that up.
Yeah.
So
or even,
I thought,
yes.
if I can, so I thought if I can make the doctors tell women what I wasn't told, and I also didn't get that patient information book. I did a survey, I think I had over 4,000 responses, and 84% of women never got that literature.
No, or you get it after they're implanted, or you get it with your stuff on hydrocodone after anesthesia here. And don't forget to get antibiotics before you get a teeth cleaning. Like what?
You're absolutely yes.
So
I get my teeth cleaned every 3 months. I'm not taking antibiotics every 3 months.
Yeah.
So I thought this can't keep going on. And if the doctors aren't going to do the right thing, then let's pass a law.
Just
mandating
let's pass a law. And she did it, folks.
We can revoke their license, suspend their license. This is not okay.
So how did, what was your next step after, like, oh, let's pass a law. Okay. Then what? Like, how did you know what to do? This is.
I had no clue what to do. Absolutely zero. But I did have a breastie here in Arizona, and she grew up here and went to high school with one of our state senators. And she reached out to her, gave her story and some background information on what has been going on with the FDA. And we all met for coffee, the three of us. And she said, okay, she goes, I've never done, a bill like this before, but let's talk to a couple other people and see what we can get going. So that's how we started. We had a couple initial meetings with health policy advisor and a couple other senators that were on the health committee. And they decided this was an important piece of legislation that needed to be passed, and let's move forward.
Nice.
So it kind of just from there happened organically. And because I'd never done it before, I was just flying by the seat of my pants. But we ended up having a really great group of collaboration with the committee and the Arizona Medical Association, the Arizona Society of Plastic Surgeons, who I had already been working with for over a year. So it was nice to have the support and participation of all the stakeholders. The hardest part was, it was pretty grueling to come up with the language of a law. I mean, I've never done that before, and I didn't even know the process. So the hard part is done. And I thought, okay, we did this in Arizona. Why can't we do it in California and some other states? If we could, it doesn't have to be the exact same law, but if we could model it after the wording, that we have in the Arizona bill, I think we could, get nationwide.
Yeah, could you, and you don't have to say the whole law. What I know is like, and I could have it wrong. I remember talking to my plastic surgeon and saying, hey, I don't feel like I had an informed consent. And so they had used the consent form that their board, their plastic surgery board, said, this is acceptable. And it was not, right? And so, and that's where I sort of got stopped and didn't know how to like forward that discussion. Like how, I have two questions, I think. What basically is the wording? Not exactly, but like I had a hard time finding who's accountable.
So the main points of the statute are that the surgeons have to provide that manufacturer information. That's going to be mandatory. I've found out a lot of why that pamphlet isn't given to patients. The plastic surgeons aren't getting them from the manufacturer. And I've talked to many plastic surgeons who say, oh, we get a whole shipment of breast implants in a big box, and there's maybe 2 of those booklets. And FDA's pre-market approval agreement, those manufacturers are required to provide one of those books for every patient.
And it's not like, it's not like
and we all know the manufacturers have so many violations.
Well, they'll have, like, with Allergan, they'll have it, but it's on page 7 of their website in smaller. Maybe sometimes it's like, I think it's italicized now, right? So it catches your attention in size 6 print versus the 14 that's on the rest of it, right? But there's no checkoff that the physicians have read it, or that then there's a informed consent portion about it, or.
In the book, there is a page in the back that the patient and the doctor are supposed to sign. And it says in Allergan and Mentor, in their PMA approval agreement, it says that the patient is supposed to sign off on it. And that's not happening. So our law will mandate that patients get that information. We also created a patient-doctor checklist that we worked really hard on. It's really hard when you dive into all this stuff with the FDA and the manufacturers and side effects. It's hard to it's easy to get caught up in the medical terminology, but the reality of it is, for the 22-year-old woman who just graduated college and is starting her career and wants a boob job, she's not going to understand a lot of the language in these informed consent documents. And I have kids that age. I have a 21 and a 19-year-old, and they don't know what connective tissue disease is. They don't know what fibromyalgia is, or even if they did have it, what it would feel like. So we made sure to really put that checklist in layman's terms so that anyone who's receiving breast implants can clearly see the side effects that can happen. And it's all about making an informed choice. We're not here, like you said earlier, Danielle, if you want implants, I'm not here to tell you not to. I'm just saying, educate yourself, read what can happen. My biggest advice to anyone who wants implants is to watch a surgery on YouTube of getting implants put in, of getting a revision if you have to have one for capsular contracture, and watch an explant video, and then decide, do I want to do that to my body?
And then you tell me that's not major surgery.
Yeah.
Go ahead, try. When for implants, when you lift the pec muscle, cut the pec muscle, that's reconstructive surgery. And we make it sound like it's like, oh, everybody's doing it. It's fine. I do it every day.
Yeah.
Let alone what you're putting in.
Here's under the muscle. Mine look great.
Yeah. Oh, and then when you get a capsular contracture, there's a reason, right? What is your body doing to protect you? Like maybe you should leave the relationship of the implant and the body. Maybe there's something to consider, right? Like if someone,
right.
There's so much more to just be with, and we don't know that it's like I was looking back at the history. How much I mean, and then for the breast cancer women, like I have two friends going through, they just got diagnosed with breast cancer. And before they were even known if they were going to get chemo or radiation, they were already talking about reconstruction. And this was the process. I mean, I'd like to think they still had choice, but this was the process. And on some level, I say, thank God we're thinking of the future, but we're not fully disclosing. Like, I love that we've come from like, okay, just, mastectomy to do nothing, and now we can't do anything, to thinking about it ahead of time, but there's still not that full disclosure.
It's disappointing to me that with breast cancer women, I feel the doctors are more concerned with the aesthetics than patient health. It is clearly stated in the manufacturer's patient information literature that radiation or that expanders are not supposed to be left in the body for more than 6 months. It says that it is not recommended to have any kind of reconstruction if you are still undergoing treatment or will need future treatment. Yet we have doctors that have put in expanders in patients for up to 2 and 3 years, which is a temporary device not made to be in the body.
And post-surgery, you're not done anything yet.
Breast cancer patients.
And post-surgery, you're not done. And then there's a difference. I think do you think there's a distinction between oncology and plastics and route of healing and like how we funnel people in the US?
There's a lot wrong with, I don't even know how to fix it. I will say that the first time I was diagnosed with cancer in 1996, I did feel like I was treated fairly, and my oncologist was honest with me. Fast forward 22 years, and when I was diagnosed with breast cancer, I did go to one of the large cancer centers. I was at Ironwood Cancer Center, and I felt like I was just treated like a number and herded through like cattle. You have cancer, you get chemo, you get radiation, you get surgery. Next, please. I actually fired my entire team of doctors because they were not looking at my entire health history and my high risk situation in developing secondary cancers. They wanted to put me on hormone blockers that had a high risk of getting endometrial cancer and uterine cancer. Well, I already have a risk of getting cancers from my radiation: lung cancer, breast cancer, thyroid cancer, stomach cancer. Why would I want to add an additional pill that they want me to take that'll increase now 2-3 more female cancers? And the funny thing about the hormone blockers that they push on us, it's big pharma. My breast cancer was hormone driven, but I only had 2% progesterone receptors in my body. Yet they wanted me to be on a hormone blocker for 10 years for 2%. The risk does not outweigh the benefit there. Or I'm sorry, the benefit does not outweigh.
But how do you even know to think about that? As a human under stress, trying to find rest and safety in a doctor's diagnosis and, plan. How do you even know to be like, hey, I only got 2% hormone receptors?
Any women that would know to
honestly, if it was my first cancer, I probably would have just done whatever my doctors told me to do. But I know better. I've been through it 3 times, and I do my own research, and the numbers weren't adding up for me to harm my body that badly. For a tiny percent chance of a 2% progesterone receptors. Now, if I was 98%.
Oh, yeah.
Then
I mean, I love that we can have the choice, but I want the empowered choice, right? And there's other things we can do to optimize your receptors from an integrative functional medicine, and we don't have the studies to say what this will or will not do.
Yeah. And they didn't like that. They didn't like me declining chemo. They didn't like me declining tamoxifen. My oncologist actually looked at my mom and told her, if your daughter gets cancer, it's going to be stage 4. You know, trying to scare my mom into talking some sense into me, because clearly I'm not thinking straight, you know. So I was done.
Wow. So really, not only have you
But,
been such an advocate for so many other people, but you have been your own advocate for really quite some time, Danielle. Oh my God.
It's because you love us both. I love it.
Robyn.
Yeah, I mean, that is my biggest piece of advice for anyone going through any medical procedure or treatment. You have to be your own advocate. And listen, I know the United States is one of the sickest countries in the world. Doctors see so many patients on a daily basis. I'm sure it's hard to keep it all straight and really give the quality one-on-one care that each patient deserves. But you know, there is a patient responsibility as well. And I feel like if you take control of your own medical information and make sure you educate yourself, but it's a double-edged sword too, because doctors don't like it when you come into their office and tell them what you read on Google, and they say, "Oh, stay off of Google," or, you know, WebMD, and which is tragic. And you know, I saw a statistic the other day, and you can't quote me on it because I can't remember where I saw it and what the source was, but it was saying that patients actually trust and get more of their medical information now online and in support groups and social media than they do with their doctors.
Yeah, and what do you think that, so like, I'm gonna like be like the devil's advocate as a practitioner and as a patient, but like what's really interesting is when a client comes in and says, I'm plus MTHFR, and they can't even say what MTHFR is, and I'm trying to share with them, and you have this much time. Like for me, I'm lucky because I get an hour or
Right.
more. Like I'll spend whatever it takes, so to speak. But like when there are some people who are hell bent that this is why I'm sick, and I'm like, like, right? And it is a challenge. It is, and I don't mind people educating and being knowledgeable, but there also needs to be a safe place to go and get correct navigation, right? I don't
Right.
coach me on this one, Robyn.
Medical advice, because you know there is a lot of misinformation in like
or this information.
Groups. If it's not a group that's actually, you know, put on by a medical practitioner with, you know, a medical license and practicing medicine, anybody can go online and say anything they want. But I think what people are doing now is they're going to their doctor, they're getting their diagnosis or their doctor's opinion, but sadly, we've lost such trust in our doctors. And so what they really want is they want to talk to real people who have breast cancer, real people who have, because I've seen women in these breast cancer groups that say way more to the other women in the support group than they do with their doctors. And when their doctors tell them, well, this, and this, they're like, you know, I really want to hear it from the horse's mouth. I really want to hear it from 10 women who have been through breast cancer and had this kind of chemo.
Yeah.
So
and what's your tissue like after chemo and radiation?
All of that is that, right. But my hope is that doctors will start listening more to their patients, because their experience is valuable and it shouldn't be discredited.
Oh, totally.
You know,
I
don't have a medical
agree,
degree,
and I didn't want to. Hopefully, I didn't come off like it to discredit it. And like I think we as practitioners have horse blinds. This is my field of study, right? What do you mean you're over here? Like, I can't see you. And same for the patient. Like, there's got to be a listening on both parts, and then hopefully some understanding. And I'm learning as I get older and more experienced in my practice that evidence-based medicine is evidenced based medicine. It's not who you are, Robyn, as a client, a patient, like there's different things for different people. And then you add a little core beliefs in that and what that looks like and how that manifests in your life. I think it's almost more important to empower the patient or the me, or you empower you. What does that look like for you versus trusting everything and, like where can you find your own rest and digest, so to speak, right? And it's hard.
Right.
Sorry. Again, a little deep, sorry.
Though, don't you guys feel like there's a shift? No, you're fine. I feel like there's a shift happening though.
Yeah.
But I don't know if it's just my world or if it's everybody's world.
I think there's a shift in seeing injustice.
No, I see it.
Kind of across the board. We're opening our eyes to a different way of looking at things. I know when I was younger, I was led to like, okay, you listen to the authorities, you listen to the doctors, you do as they say. And now we're kind of like, well, wait, why can't I ask why? This is my body and this is my health. And so people are becoming empowered, I think, as a whole to say, oh, okay, wait a minute. I don't know about that. And I think it's huge. And so I see a shift, and I think it's going to be a shift in a good way. It might be a little bit ugly on the way there, because there's going to be this like push and pull, between everybody who's involved. But I think that the end result down the road is going to be great. I think that everything that we're doing is part of that. So this is huge.
Yeah, I hope that practitioners take on a navigation role versus I've got to fix you, I've got to do this, and I've got to, like, this is statistically what you should do or whatever. Like, I hope we can navigate and not so much refer out per se, but like literally be like, hey, here are some choices. I know my wheelhouse is this. I can help you if you choose that. And, go see so-and-so because their warehouse is this or their warehouse is this or, and I think too, Robyn, I'd love to know your pearls.
It's coming.
How do you slow the process down? Like, how can women who get diagnosed with breast cancer, which feels so urgent, and I mean, I can't say it feels that way. I can only imagine, right? But how do you wait? My life, my voice, holy shit. Who's on my team? Like, how can we leave women, not even just the breast cancer women, because this is for all of us, right? But how do you be like, take a breath, it's here. And then what?
I think that's a very difficult piece of advice to try and give breast cancer. I have no idea why. I'm not like the one that freaks out. It's like, okay, hey, you have cancer. I'm like, great, this is what we're going to do. Just like that, like matter of fact, but it's not like that. Most people, when they hear the words you have cancer, they're crying, they're upset, they're picturing their death and, I got to go do my will. And, I'm like, how are we going to fight this? And who do I need to talk to? But it is not an easy task, I think, for most people to navigate through because it's very emotional. And I don't know, like it was the first time for me. I mean, I was 23 years old. I was a young kid. I didn't know anything. But as I've gotten older and had a bunch of health issues over the years, I'm like, you just got to do what you got to do. I wish there was a piece of advice that I could pull from all of the knowledge that I've learned through meeting other breast cancer survivors, but everyone's journey is so unique and different, and it looks completely different for one woman to the next. Just have my best advice is to have a support system. Be honest with your feelings. Be honest with a lot of people, I think, feel like they have to be strong. I have to be strong. I have to be a warrior. I have to fight this cancer and be a cancer survivor, you know, hey, if you have a bad day and you end up on your closet floor crying, you're allowed to have that day.
Yeah.
And
Or 2 or 3 or 5.
I don't think anyone should feel like, you know, they're less of a survivor if they're having a bad day and they're having a breakdown and they just are tired of it. Cancer is tiring. It is exhausting. It is a full-time job to go through treatments and appointments and labs and scans and blood work, and it's exhausting. And I mean, and you're not even getting paid like a real full-time job. So you just got to be real with your support system. Ask for help when you need it. That's really hard for me. I am not the type of person that asks for help. But you know, I had my double mastectomy 6 days before my son's high school graduation. I needed help.
Yeah.
And the timing of that was very humbling for me, because there was no way that I could pull off cancer, surgery, graduation party without help. So definitely ask for help, definitely ask for support. That's the best thing I ever did through any of this whole mess that I've been through, was to ask for help and accept help, because I knew I couldn't do it. And there's nothing wrong with that. I shouldn't have to do all that. And I mean, I had a wonderful community that came and brought meals for my family. Two of my best friends came and helped set up for the graduation party. And, you know, it was a blessing. And as much as people think cancer's a thing to happen, which it is, look for the blessings in your experience and the positive. There's always something positive. I mean, the timing of my last cancer was horrible for my family, but you know, that summer we kind of had a chill summer. My son had broken his foot and we were in recovery together and we watched Netflix together. And most 16-year-old kids aren't hanging out watching movies, but you know, he has a broken foot and I just had surgery. And that was a huge blessing for me to be able to spend that time with him and have those memories, you know. So I experience as this horrible cancer experience for me, I'm like, hey, I got some really cool time with my kid that I normally wouldn't have gotten, just because the timing coincided with him breaking his foot. So those are the things I choose to focus on, because those are the things that keep me going.
Yeah. No, I appreciate all that. I think that's good for anybody.
Yeah.
Hopefully, I mean, I think that's just good advice, period, for life.
Agreed. I agree 100%. I think that Robyn, is why you have done so well with battling cancer 3 times. I think your mindset is such a huge blessing to you, and now you're sharing it with others. It's a huge blessing to others. So we adore you, and so happy that you were here to tell us your story and all about your advocacy, and keep kicking ass, because you're an inspiration to all of us. I do hope that one day we can work together and you can guide me through the whole legislative process here in Jersey, because we all need to see these changes happen. So you're a rock star and we love you. And thank you so much for being here with us.
Thank you, Robyn.
Thank you guys. I love you guys so much. And just look at the blessings that we got from breast implants, which sucked for all of us, right? But we would have never met each other otherwise. And that's my joy in all of this.
True.
100%, me too. I mean, I live for our community, and I'd be lost without all of you guys. So
True.
All right, everybody, thank you guys for watching. And Robyn, thanks again for being here. Danielle,
Thank you.
as always, love you. Love you, ladies.
Bye.
Bye.
Bye.